You are welcome to Tapia Remedies. Kindly subscribe to our YouTube channel and let's learn as we always do. Today we are going to talk about an interesting topic. We're going to talk about menstrual pains. We're going to talk about menstrual pains or dysmenorrhea. So when we talk about menstrual pains or dysmenorrhea, this is known as a painful period or menstrual cramps. Simply the occurrence of pain during menstruation. It usually begins around the time that menstruation begins. Symptoms typically last less than 3 days. The pain is usually in the pelvis or lower abdomen. Other symptoms may include back pain, diarrhea, nausea. In younger women, painful periods often occur without an underlying problem. In older women, it is more often due to an underlying issues such as uterine fibroids, adenomyosis, or endometriosis. It is more common among those with heavy period, irregular period, whose period started before 12 years old, or who have a low body weight. A pelvic exam in those who are sexually active and ultrasound may be useful to help in diagnosis. Conditions that should be ruled out include ectopic pregnancy, pelvic inflammatory disease, interstitial cystitis, and chronic pelvic pain. Dysmenorrhea occurs or menstrual pains occurs less often in those who often exercise and those who have children early in life. Dysmenorrhea is estimated to occur in 20% to 90% of women of reproductive age. It is the most common menstrual disorder. Typically, it starts within a year of the menstrual period. When there is no underlying cause, often the pain improves with age or following having a child. Okay, let's look at the causes of menstrual pains. Dysmenorrhea can be either primary or secondary based on the absence of or presence of an underlying cause. Secondary dysmenorrhea is dysmenorrhea which is associated with an condition. The most common cause of secondary dysmenorrhea is endometriosis, which can be visually confirmed by laparoscopy in approximately 70% of adolescents with dysmenorrhea. Other causes of secondary dysmenorrhea include leiomyoma, adenomyosis, ovarian cyst, and pelvic congestion. Unequal leg length might hypothetically be one of the contributors, as it may contribute to a tilted pelvis, which may cause lower back pain, which in turn may be mistaken for menstrual pain. As women with lower back pain experience increased pain during their periods, other skeletal abnormalities such as scoliosis, or sometimes caused by a spinal bifida, might be possible contributors as well. Let's look at risk factors. You may be at a greater risk of menstrual cramps if 1. You are younger than age 30. 2. You started puberty early at the age of 11 or younger. 3. You have heavy bleeding periods or menorrhagia. 4. You have irregular menstrual bleeding or metorrhagia. You've never given birth. Also, you have a family history of dysmenorrhea. You are a smoker. Symptoms of menstrual pains. The main symptom of dysmenorrhea is pain concentrated in the lower abdomen or pelvis. It is also commonly felt in the right or left side of the abdomen. It may radiate to the thighs and lower back. Sometimes symptoms often co-occurring with menstrual pain include nausea and vomiting, diarrhea or constipation, headache, dizziness, disorientation, hypersensitivity to sound, light, smell and touch, fainting and fatigue. Symptoms of dysmenorrhea often begin immediately following ovulation and can last until the end of menstruation. This is because dysmenorrhea is often associated with changes in hormonal levels in the body that occur with ovulation. The use of certain types of birth control pills can prevent the symptoms of dysmenorrhea because they stop ovulating from occurring. Some non-pharmacological interventions of menstrual pains. Number one is a topical heat. So you have to apply heat on the pelvis. Again, exercise is also good. Exercise is widely accepted as a means of moderating stress and stress-related symptoms because it causes the release of endorphins by the brain. Nutritional considerations first. You have to consider what you eat. As they say, what you eat is what makes you. Avoid refined carbohydrates. Stick to a whole grains like oats, millet, brown rice, quinoa, and etc. Eat only 3 servings of grains at most a day. Eliminate sugary foods and processed sugar. This is where most of our ladies find problem. Choose a very limited amount of honey or agave. Choose stevia as a sweetener when possible. Yes. Consider eliminating dairy. Dairy products are congesting to the body, and many doctors have seen a reduction in menstrual cramp pain in women who eliminated dairy products. If you choose dairy, try to purchase organic or organic raw dairy only to avoid added hormones. Reduce red meat and egg yolk consumption to at most 2 to 3 times a day. Also, eat lots of fresh fruits and vegetables. Let's look at phytotherapy, plants that are very useful in the management of menstrual pains. When considering using herbs for menstrual cramps, we have to consider how herbs work in the body. We have to consider the therapeutic goal of the treatment. Menstrual cramps have more to do with than just pain. While some women have heavy bleeding with their painful period, others have a sense of stagnation, a bulging uterus with a very scant period. Yet both of these can fall under a diagnosis of dysmenorrhea. We must also consider hormonal balance, nutritional, digestion, mental, emotional state are some of the herbs used in the management of menstrual pains. Phyllanthus fraternus, Kaya senegalensis, as we all know as mahogany. Alponia cordifolia is also good, and Astonia boni. So if you really want to treat your menstrual pains, you have to follow all these we've mentioned here. You have to take note of every bit of information we've posted here, because the pains are very unbearable. So kindly take note of these tips and stay healthy. Subscribe to the channel for more.